vaginal odor. Yes, you see some men, they'll come to me, nurse, my wife is pregnant, and what's the cause of this vaginal smell? The cause of this fishy odor that my wife is having? Hi everyone. So it's your girl Esther. Okay. Yeah. How are we doing? Good morning, good afternoon, good evening, depending on where and where you're watching me from. It's still your girl Esther. Okay. Officially Lolo Obieze. Okay. How are we doing this morning? How are you, my beautiful family, friends, fans, everyone? Yeah. I'm glad and I'm happy to have you all here. Please feel free to like, comment, share. Let me know what you want me to talk about. Let me know if you're enjoying my videos. Let me know what you feel. Okay? Tell me what you want to ask. Okay? Anything, feel free to talk to me. It's your girl and I'm happy to answer you. I'm happy to work with you. I'm happy to do this channel with you. Okay? Just keep looking beautiful and shining. Just the way we did. Love you, darlings. Yeah. So today we're going to talk about something very interesting. Something very, very, very interesting and educating. So feel free, relax, be comfortable. Join me. Let's do this. All right? Now, for the men, if you come to tell me my wife's vagina is smelling, hear this. Sit down, grab a chair, get your cup of coffee, okay? Drink and listen to me. And if you're a lady, you're so worried, my vagina smells when I'm pregnant. What do I do about this? What is this? What does it mean? Now hear me. This video is for you. It is for you. Just grab your seat and hear me out. So, on today's episode, I'm going to be talking about a condition called bacterial vaginosis. You heard me, bacterial vaginosis. Today we are talking about your health. Every day is not about culture. Every day is not about something else. Today we are going to talk about your health because I promised you I'm going to be talking about your health. I'm going to be giving health tips. I'm going to just be providing you with information, educative ones, beautiful contents, and I'm doing that. I'm glad I'm doing it. Okay, and I hope you're enjoying it. Today we're talking about bacterial vaginosis. What is this bacterial vaginosis? It's actually a common condition that is seen in women whereby the vagina releases a fishy smelling discharge. Yeah, that is what it is. Okay. So, and with this topic, bacterial vaginosis, I'm going to be highlighting some things you need to keep in mind as we discuss this. I'm going to be talking about what we call pH. What is pH? pH simply means a potential hydrogen, which shows the level of acidity, the alkaline, and the neutral level in the human body. Okay, so the human body has got what we call pH, and it's simply telling you that there is acid in your body, acidity. There is a level of alkaline, like alkalinity of your human nature. Okay, and then how neutral it is. This is not just like it's in your pH of your urine, pH of different things in your body. Okay, so the vagina also has a pH. Okay, and I want to let you know that the pH of the vagina is for a woman is around 3.8 to 4.5. That is the pH of the woman vagina, 3.8 to 4.5. That is the normal, the ideal pH level of the vagina, and that is what it should be. And you know, when there is a problem with this pH, when it's affected, when it's more acidic, when it's more alkaline, there is a problem. It should normally be acidic, and it should be within 3.8 to 4.5. Okay, so you will still hear me talk about normal flora. Normal flora that are just like, they're actually microorganisms that are not harmful to you. They're not harmful to the human body at all. They are permanent residents. They live with us and within us. Okay. Also, you'll be hearing me talk about estrogen, progesterone. I know you must have come across these terminologies and you'll be wondering, the doctor keeps saying my estrogen level is high, progesterone level is high. What's actually happening to me? Nothing is happening to you as a woman. You've got estrogen. These are hormones. You've got estrogen. You've got progesterone. What's the work of estrogen? Estrogen is actually a hormone in the human body that helps to form the sex characteristics of the woman. Yeah, you've got breast, you've got the womb, you've got everything like that. All your endowment that makes you a woman. These are the responsibility of the estrogen. They do this, they produce all this. Okay, and what's progesterone? Progesterone is actually a hormone also that helps you to nourish your body. Yeah, women, we've got lots of hormones that help us to become what we are. Progesterone is actually a cousin to estrogen, and the work of this progesterone is to help you prepare your breast for breast milk when you are pregnant. Is helping you nourish your womb, nourish your uterus. Womb, you heard me? I promise you that I'm going to bring it so down so that everyone can understand me. So progesterone helps to nourish your womb, prepare your womb, preparing you for conception. The progesterone helps to prepare and relax your muscles while you're pregnant. You see a pregnant woman during the time she is due, yeah, towards the end of her pregnancy, you see her complaining of muscle weakness, the pelvic pain, and all of that. Yeah, the progesterone is actually relaxing all these muscles so that there will be free passage. And you know, when these hormones are being altered because of pregnancy and everything, it's definitely going to lead to some things. When I'm come to the aspect of the causes of this bacterial vaginosis, I will tell you how these hormones contribute to this bacterial vaginosis. Okay, so the last but not the least, you're going to hear me talking about leukorrhea. What is this leukorrhea? Leukorrhea is the normal whitish discharge that is seen produced by a pregnant woman. Yeah, you see pregnant women, they often have discharges and all of that. They're actually white in color. They're just the normal discharges. They're no problems. They're normal discharges that come out during pregnancy, and all these are helping you. That they might be coming from the fallopian tube, coming from the cervix, coming from the uterus. They are just helping you clear the passages. Yeah, they are clearing and washing and cleansing the vagina, the female reproductive system. That's so normal. Leukorrhea is a normal thing that comes out during pregnancy, and they come out as discharge, white vaginal discharge. Leukorrhea are called the white, because the color should be white and milk. When this leukorrhea is seen to have changed color, let's say the color turns to yellow, become yellowish, or it become greenish, there is a problem. Remember, bacterial vaginosis is setting in. And when this leukorrhea becomes smelly, foul smelly, fishy smelly, foul smelly discharge, when it becomes fishy, you know how fish smells, then there is a problem. Bacterial vaginosis set in. That is it. Now, let's come back to our topic, bacterial vaginosis. As I said earlier, bacterial vaginosis is actually a common condition that's seen in most women, whereby there is fishy discharge, foul-smelling vaginal odor. That is what bacterial vaginosis is all about. Now, let's talk about the causes. 1. Hormonal changes. I talked about estrogen and progesterone. During pregnancy, there is influx of hormone. Women, a lot happens during pregnancy. You see the estrogen level is high, progesterone level is high, this one is falling, that one is falling, and these ones are going up. So it's actually going to affect a whole lot in the human body. So because of this, the influx and the up and down flow of the hormones is actually going to affect the normal pH of the human body. And as a result of this, bacterial vaginosis can set in, and this woman can start experiencing foul-smelling vaginal discharge. Because the pH level, which should be normal, is what affected. Either it's becoming acidic, higher than it should be, or it's becoming alkaline. That is, it's being neutralized. One other cause of this bacterial vaginosis is lifestyle. Yeah, lifestyle. During pregnancy, women take a lot of supplements. Some women can get dehydrated because they're not able to take in fluid or retain fluid, so they become dehydrated. And you know, when a woman is dehydrated during pregnancy, it's affecting a whole lot in her body. It's affecting a whole lot in her system. So dietary preferences also. Yeah, when you choose to or stick to a certain type of diet, this is just what you want to eat during pregnancy. You are not taking enough fluid, you are dehydrated. It's affecting you, and it's affecting the normal pH of your human body. It's affecting the pH of your vagina. Yeah, it is. And you know, when it's anything that alters the normal pH of the vagina is definitely going to make or expose you to bacterial vaginosis. Another factor is infections. Infections like UTIs. What are UTIs? Urinary tract infection. We are not going to talk a whole lot about urinary tract infections today. Yeah, it's a topic for another day. Yeah, but women are at high risk of developing urinary tract infection during pregnancy, which are infections. And you know, when there is UTI, urinary tract infection, the woman tends to start having a vaginal discharge, and itchy vaginal discharge, smelly discharge. You know, it happens. One other cause is bacteria imbalance. What do I mean by bacteria imbalance? Bacteria imbalance is simply, you know, I talked about normal flora, which are permanent residents. They are just like our friends, colonies. They've come to stay with us, to live with us. They're not harmful to us. And when there is a problem with this bacteria, yes, normal flora is actually a microorganism. And when there is a problem with it, when it's affected, when it's behaving in a certain way that it shouldn't behave, there is a problem. You know, when you use certain chemicals, or when you predispose yourself to certain things or conditions that makes the normal flora to behave in a certain way that it shouldn't, it's affecting you and is therefore damaging or altering the pH of your vagina. So now I'm going to talk about the predisposing factors of this bacterial vaginosis. One is what? IUCD. What is IUCD? IUCD simply means intrauterine contraceptive device. Yeah, women that are on IUCD or using it as a means of family planning, yeah, they're at higher risk of developing bacterial vaginosis. Having new sex partner can predispose you to bacterial vaginosis. Multiple sex partners can predispose you to having what, or developing bacterial vaginosis. Yes, pregnancy can actually predispose you to having bacterial vaginosis. One other predisposing factors to this bacterial vaginosis is what we call douching. You should use clean water to wash your vagina and not soap. When you introduce all these chemicals to your vagina, you're altering the pH of the vagina and thereby damaging the normal flora. You use your tampons and leave it there for a very long period or hours. You can predispose yourself to infections. What are the signs and symptoms of this bacterial vaginosis? 1. Foul, smelly, fishy vaginal odor. Yes, you see some men, they'll come to me, nurse, my wife is pregnant, and what's the cause of this vaginal smell? What's the cause of this fishy odor that my wife is having? One of the symptoms that you're experiencing this bacterial vaginosis is foul, smelly, fishy vaginal discharge. uncomfortable sensation, itching. Yeah, itching down below. It's actually painful and horrible. I know it can be embarrassing when a woman is itching down below. Another signs and the symptoms is pain during sex. During intercourse, you see some women having pain, severe pain. Hmm? And you know this discharge, when you start having grey discharge, foul smelly fishy discharge, odor coming out from your private part, it can actually be is something horrible, and it's something you should be careful about. It's something you shouldn't let happen to you or your wife or your sisters or your mother. Yeah, especially when they're pregnant, you have to take caution. Now avoid, I can't leave you like that without telling you the remedy. I must tell you the remedy and some treatments. Okay, one is antibiotics. Antibiotics, yeah, and I'm not trying to encourage you to buy over-the-counter antibiotics. No, antibiotics should be prescribed by your doctor, by your physician, by your GP. You shouldn't just go on your own to get an antibiotics and take because you feel you're having bacterial vaginosis. No, don't do that, especially when you're pregnant. As a pregnant woman, you're not expected to pick any medication on your own and take. Don't do that, my friends. Okay? Yeah, antibiotics is one of the major drugs that is used to treat bacterial vaginosis. It can actually still be a gel, it can be a cream, it can be anything, it can even be a tablet. You just take it and you're fine. Okay? One of the things you should do is to avoid douching. Avoid it completely. Use water, just water, to wash down below. When you pass urine, don't use tissues. No, avoid the use of tissues, especially when you're pregnant. As a woman, you can be, when you use tissues, you know, there might be patches down there, and if you leave it there for a very long time, it can cause you itching and irritation, burning sensation. Before you know it, you start developing bacterial vaginosis. But when you are so careful, especially while pregnant, you use water to wash down below, you use clean flannels to wipe down, you're going to be fine and safe. Try as much as you can. Avoid numerous sex partners. Also, friends, one other remedy is for you to do what? Wear loose cotton pants. Cotton pants. Yes, this is what you should use, especially while pregnant. Avoid the use of nylon pants. Okay? Cotton pants are so good. They're so effective and protective for you as a pregnant woman. Okay? And make sure your personal hygiene is at the apex. Personal, take it seriously as a woman, especially when you are pregnant. You don't want to hear your husband complaining your vagina is smelling, what's happening since you got pregnant is smelling, you're not looking after yourself. Please look after yourself. Avoid the use of lubricants that have a bad pH, that you're not sure that the pH is within 3.8 to 4.5, which is the normal vaginal pH. Any lubricant you're using down below, anything you are using, any chemical you are using, which you should avoid completely. The vagina is not meant for chemicals. Vagina is something that should be cleaned with just water. Avoid lubricants, and when you are using any chemical, anything down below, make sure that the pH is within 3.8 to 4.5. And you know, this bacterial vaginosis, if it's not taken care of during pregnancy, it can actually lead to some complications. Yeah, your wife can have a preterm birth or even give birth to a baby that is less than 5 pounds. You know, when your baby is less than 5 pounds, it's not good. This can affect the development of the baby. A normal pregnancy should last up to 37 weeks. And you know, when your wife give birth at before 37 weeks and your baby is not weighing, there is low birth weight, is actually a problem. And this bacterial vaginosis can actually be the reason why this has happened to your wife or this has happened to you as a woman. One other complication of this bacterial vaginosis is what? Pelvic inflammatory disease, PID. So many women are suffering PID, they are not able to conceive, they are suffering from infertility. Infertility means simply means you are not able to conceive. Yeah, PID can actually be one of the reasons. Yeah, and bacterial vaginosis can be the cause of this PID. So try as much as you can to avoid anything that will lead you to having PID, pelvic inflammatory disease. And you know, when you have pelvic inflammatory disease, it's actually hard for you to conceive. So my fellow ladies, mothers, wives, look after yourself. Do the needful. And I promise you, you're going to be safe. Okay? Husbands, look after your pregnant wives. Now you've known the reason why they're having foul, smelly vaginal discharge. Help them conquer it, help them overcome it, and we're good to go. The world is a safer place for us all. Thank you for hearing me out. Thank you. I know you're going to like this video. I know you're going to comment. I know you're going to share. I know you're going to tell people about this. Tell someone to tell someone. You've got your nurse and your midwife. I got you covered from one and only Lolo Obieze.